Welcome to the Rising Nurses. Today we are discussing about respiratory failure. Respiratory failure happens when your lungs fail to do their two main jobs, delivering oxygen and removing carbon dioxide. This leads to dangerous level of gases in the blood which can harm in the brain, heart and other organs. Don't forget the mnemonic. F stands for failed oxygenation, A stands for accumulated carbon dioxide, I stands for inadequate gas exchange, L stands for life threatening if untreated. Respiratory failure is a condition in which the lungs cannot provide enough oxygen to the blood or cannot remove enough oxygen carbon dioxide from the blood. It's called hypercapnia. It is diagnosed when ABG, atrial blood gases, shows partial oxygen level is less than 60 mm of Hg. Partial carbon dioxide level is more than 50 mm of Hg. We have two respiratory failure. Type 1 is called hypoxemic respiratory failure. Oxygen is low. Partial oxygen less than 60 mm of Hg, but CO2 is normal. We could see in this condition pneumonia, acute respiratory distress syndrome, and pulmonary edema. Type 2 respiratory failure, it's called hypercapnic respiratory failure. Both O2 is low or normal and carbon dioxide is high. Partial carbon dioxide more than 50 mm of Hg seen in COPD, asthma, drug overdose. Remember, type 1 oxygen problem, type 2 ventilation problem. Oxygen less than 60 mm of Hg, type 2 also less than 60 mm of Hg. Carbon dioxide normal or decrease in type 1. Type 2 greater than 50 mm of Hg. Oxygenation failure, ventilation failure. Oxygenation problem, ventilation problem. We could see in type 1 pneumonia, acute respiratory distress syndrome, pulmonary edema. Type 2 COPD, asthma, drug overdose, neuromuscular disease. Type 1 improve oxygen, type 2 improve ventilation. Subscribe to the Rising Nurses Next Generation Nursing for more quick nursing guides.